One of the main questions I'm asked is, what can I expect in a plan of care that's personalized to me? And how are your plans of care different from other physical therapists in the same field? So in this video, we are going to cover just that. Hi, my name's Dr. Laura Meihofer, and on this channel, I help you gain optimal health through knowledge and movement. A physical therapy plan of care is simply a roadmap that a doctor of physical therapy uses to outline what your treatment will look like in the coming sessions, which span usually over weeks and months. One of the biggest things that I offer is every single plan of care is individualized and tailored to you. Let's go over what you can expect in that personalized plan of care. The first thing that I include is an explanation of your diagnosis. I like you to understand what I found in our evaluation, coupled with what you're telling me and how that relates to getting you better. This always allows for buy-in, and it ensures that we are on the same page as we move forward in this exciting journey. The second component is called Neuromuscular Re-education. This is just a fancy word for explaining how we're reprogramming your brain and body connection. Typically during this time, I use different things like tactile feedback, utilizing a mirror, or even biofeedback units to help you understand how your body is moving in space. I want you to know when you're contracting, when you're relaxing, and how that facilitates how you feel, so that moving forward, we can make informed decisions to ensure that you don't go back to your old habits. The third component, and oftentimes what physical therapy is most known for, is manual therapy. No, this isn't where you just get to come in and receive massage. The manual therapy that I do is always targeted to what your muscles are telling me every time I examine you when you come back to see me. So I oftentimes utilize techniques that help to relax, lengthen, and promote sliding and gliding of the tissues so that you can move better in space. Sometimes I'll use my hands. Other times I might use things like cups, dilators, or even these instruments that I can glide over the tissues or joint capsules to promote motion. Something that I think is really important and makes me different is this isn't a no pain, no gain situation. I like to always have open communication between me and you, the patient, so that we ensure we aren't promoting any negative patterns, and again, that we're taking steps towards your ultimate goal. The fourth component is therapeutic activity. During these parts of our sessions, we're oftentimes focusing on various behavioral modifications. So think diet, maybe how much fiber you're consuming, water consumption, how long you sit on the toilet, what you're doing on the toilet, how we can minimize stress, or how we can increase your consistency of doing your home program. I personally love doing therapeutic activities because we are targeting your day to day. And that's the most important thing. You can't take me everywhere, so it's my job to teach you how you can extend these comments throughout your entire life and one day not need me anymore. The fifth component of my physical therapy plan of care can sometimes be modalities. I say can and sometimes because not every patient honestly needs this. Modalities can look like heat, ice, transcutaneous electrical nerve stimulation, and so much more. Again, we utilize these tools to help you get back to activity, whether it's heat to help relax and lengthen, ice to help with pain reduction. Everything is geared to what you need to live your life optimally. The sixth component, and what I personally feel I am most known for, is your therapeutic exercise, which I oftentimes call your home program. This is honestly where you have your make or break moments with physical therapy. Again, as I said earlier, my aim is for you to not come back to me. So we want to make sure that the techniques and tools I'm teaching you in session are something that you can do at home. So whether this is strengthening, stretching, dilating, or so much more, I want to make sure that your home program is accessible, meaning it doesn't take you forever and you have the equipment you need to complete it at home, and it's something that is manageable and can be done over a sustained period of time. Personally, I like to come up with the home program in conjunction with you as we work over several sessions. I think this allows us to really see what works and what doesn't work, and we can always add things or take things out based on what you're feeling when you're doing it at home. The final component is the resource list. I have been doing this for a long time, so I know where all the good materials and products are, what's worth your money and what's a waste of your money. So whenever you leave a session with me or even the entire treatment plan, you have a list of products, blogs, articles, videos, anything that's gonna help you on your journey. One of my tried and true things that I tend to say to patients is, I'm basically making you your own physical therapist. So think of our time together as an opportunity to really learn how you can best support yourself moving forward and how eventually you'll never need a physical therapist again. If you have any questions for me, please email me at hello@laurameihofer.com, or better yet, if you're on the fence or wanting to do physical therapy, go ahead and take this opportunity to sign up for a free 20-minute phone consultation with me. On the screen, you'll see I've shared with you my favorite yoga routine. So go ahead and pop on over there, and I'll see you soon.